But Chris's mother was the very first patient treated on the very first Stand Up to Cancer melanoma trial.
Oh, wow. Wow. So she was a pioneer with you folks.
Oh, yes.
Wow.
Yeah. And she helped us move our personalized medicine treatment program forward, because at the time that we applied for this grant and we got the grant, you know, you're always an idealist that all these things are going to run smoothly and you're going to get it done and it's just going to happen. But when you're bringing that many groups together, that many drug companies together, that many drugs together, and using the technology that we were using, we had to get FDA approval.
Yeah.
And so the trial that Chris's mom was on was just a trial to prove that we could validate and get consistent information using the tools that we had. The first trial we did, the FDA would not let us treat patients with that information because they wanted to see whether or not we could validate our tools.
Okay.
Because our tools are some of the most sophisticated tools that are used in any personalized medicine trial in the world currently.
Wow. Well, Chris, tell us a little bit about what got you involved in this whole arena of melanoma awareness.
So my mother was diagnosed with melanoma. It was December of 2010, and she, you know, it was a family thing. We had a very close family. We still do, and my mother was basically the leader of that family. And so when she was, you know, going through all these different treatments and all of these different things now that she had to deal with this cancer, we were all there with her, and we were very, very close. When she did chemotherapy, she did interferon, all these FDA-approved, you know, things that didn't work. She never lost that attitude that she was going to fight this cancer. And so when she met LoRusso, Dr. LoRusso, and Dr. LoRusso said, I have this clinical trial for you through Stand Up to Cancer, my mom was the #1, you know, this is going to be it. We're going to teach this cancer a lesson, you know, it's going to leave my body. So it gave her that fighting spirit that she so needed. And so she did quite a few clinical trials through.
Oh yes, she did a lot of our phase 1 trials.
Maybe 3 or 4. And so she was always so positive, and she knew that she was going to fight it.
Right.
So I want to thank Dr. LoRusso personally, because she gave her that spirit and that enthusiasm and that positive energy that she needed to get to where she, you know, she ended.
So you didn't have the results that you had hoped that these clinical trials would have.
Unfortunately not.
But this has motivated you to take action that not most families do.
Right.
Most families, you know, have to accept that their loved one may not have been successful with treatment. But can they do something in their memory? Yes. And you have done that.
Yes. So following, my mother passed away a year ago now. It was July 2013. So since the passing, my husband and I, we started a group underneath Stand Up to Cancer, because we knew that Stand Up to Cancer was her, I mean, she loved Stand Up to Cancer. It gave her that fighting spirit. So we started a team, we started a fundraising team, and we named it Stand Up to Melanoma, specific to her cancer. And to date, we've had numerous events throughout the Metro Detroit area, and we've raised $12,000 for melanoma.
Wonderful. So. Well, thank you so much for doing that, because you know, we wish that the money just rolled in to do this kind of stuff, but you have to be an advocate.